In the news this week, the cost of living priorities, rising prices of food and mortgages are not the number one concern according to an exclusive Newspoll.
Also tonight, WA's leading doctor urges the McGowan government to encourage mask wearing following ambulance stress.
The Biloela family returns to Queensland as their 4-year ordeal draws to a close.
Perth's brightest and smallest engineers overcome disappointment from missing out on an international competition, and later Dr Andrew Miller's comment.
This is The Evening News with Ivan Loom and Maliva Thorne.
Good evening. The issue of mask wearing in a moment. But first, the skyrocketing cost of living and inflation has many Western Australians on edge. But surprisingly, spikes in food, petrol, rent and mortgages are not the number one concern according to an exclusive Newspoll. Close to half of participating WAMN News viewers prioritise a reduction in household electricity and water charges instead. Nelson Liu with this exclusive report.
Up and up and up. Costs are on the rise and WA is struggling.
It's a very clear message that people are out of pocket.
Hip pockets are being hit hard across the state, and now West Australians are telling us what they think is important to tackle the cost of living.
It would definitely be one of the key factors that is affecting everyone.
WAMN News conducted a poll this week surveying West Australians about which costs should be reduced from a list of 6 options. Utility bills, including electricity, gas and water, topped the list at 41%, followed by food on 21%. Rent and mortgages came in at third at 17%, ahead of fuel costs at 11%. 7% thought medical costs should be cut, while just 3% thought phone and internet bills were a priority reduction. Finance experts say the results aren't surprising.
I really appreciate that utility is something that would impact every single one of us.
They say housing also remains a concern for people currently in the property market and those wanting to buy a home, following the Reserve Bank's increase in the cash rate to 0.85%.
I guess it's pretty obvious what that really means to all of us is that for those of us with mortgages to pay, we have to pay a little bit more. For those who are thinking of buying in the near future, a high interest rate implies a lower loan amount that he or she can get from the banks.
Meanwhile, the opposition has backed West Australians, including young people, targeting the McGowan government's high costs and stagnant wages.
It's really interesting that people are saying that the costs the government imposed are the ones that they're most concerned about.
They believe its $400 electricity rebate in the state budget will help households, but the government could be more generous, following a $5.7 billion surplus from iron ore royalties. They say the message to Premier Mark McGowan is simple.
Let's make it as cheap as we possibly can.
Nelson Liu, WAMN News.
One of Western Australia's leading doctors is urging the McGowan government to encourage public mask wearing following another week of stress on the WA ambulance system. St John Ambulance Service was quoted as experiencing extremely high demand on Friday afternoon. Australian Medical Association WA counsellor Dr Karina Powers says it's important for West Aussies to mask up to protect ambos. She joins us now. Dr Powers, thanks for your time. Given that ambulances are under pressure, what needs to be done now?
Well, at the moment, clearly our ambulances are still being ramped and we've got a terrible amount of illness ending up in hospital. So really we should be doing everything we can to take the edge off those ambulances needing to be used. And that means if we wear our masks, I know a lot of people have thrown them away or they're not using them, but if we wear our masks, we're going to cut the spread of disease. The most effective mask is the P2 or N95. After that, your blue surgical mask, and at the bottom for effectiveness usually is the cloth mask. But really, any of these masks, if you can put them back on your face, it's going to help our ambulance drivers and our health system cope better. Also, making sure you've had your flu vaccine and your COVID vaccine up to date with whatever you can access, that is going to help them as well. So influenza and COVID-19 airborne disease that you can help control by wearing a good quality mask, particularly such as the one I've got around my neck.
Why should masks return, given that the government is acting on expert health advice?
Well, clearly, if our ambulances are ramped, then people are not getting service in a timely way. And it means if you have a heart attack and you're calling for an ambulance, I understand that they're experiencing difficulty, and it would be great if everyone could help out our healthcare workers with wearing a good quality mask or any mask that they've got access to at this point.
Medical staffing stress will continue. So is it warranted to have the mask mandate return?
Yes. So looking at this from the point of view of an occupational physician, we've got stress on staff. Apparently staff are off sick. Apparently there's too many patients calling for ambulances to be dealt with in a timely way. Ambulances are getting ramped. Really, if there's enough pressure and that people are going to be dying because ambulances can't service the population in time, then we have to take pressure off these staff. And certainly in that situation, the government can size things up, and a mandate is something that's in their armamentarium of how to protect the health of the population.
Dr. Powers, thanks for joining us this week.
Thank you for having me.
And here are the top stories making news in Perth this weekend. Western Australian nurses have rejected the latest pay offer from the McGowan government based on a union survey. Under the current economic situation, 41% of nurses want a pay rise between 4.5% to 5.5%. WA registered nurses are the second lowest paid, with the ACT leading the nation at more than $95,000. More than $5,000 ahead of WA per year, according to the ANFWA Assistant Secretary Janet Ree.
The West Australian Government has a budget surplus of $5.7 billion. That's surplus, they're in the positive. They can only manage a $1,000 bonus, and wage increases capped at 2.5% per year. What is worse, this comes after 4 years of wages capped at $1,000 increase per year. So our wages in real terms have been going backwards for nurses and midwives.
The Biloela community has welcomed back the Murugappan family after 4 years of uncertainty. The family flew out of Perth on Wednesday morning to Brisbane, arriving back in the central Queensland town on Friday. They were granted bridging visas by the new Labor government to return to Biloela, where they'll wait while the government considers permanent residency for the family.
Today, as it coincidentally happens, is actually Tanika's 5th birthday. It is the first birthday that she's had that's actually out of community detention. This is the very first birthday that she's actually able to celebrate, and she's celebrating it in Biloela. What the family now needs to do is to apply to the Minister for Permanent Residency. The Prime Minister has indicated that that will be a formality, and it is something that they can put in place fairly quickly. There should be no impediment to it. So it looks like it's going to be fairly smooth sailing from here, but it will still require the Minister or the Prime Minister to put that in place over the next few days. Now, what we hope to see is that that will happen sooner rather than later. Once that is approved and the permanent residency comes into play, then the family is actually very safe in knowing that they don't have to be going anywhere, and that they are now permanently resident in this country, and their children can grow up in the country that they were born in.
The Western Australian Government has revealed a massive campaign to educate young people on the dangers of vaping. While selling e-cigarettes and vapes to anyone is illegal in most situations in WA, Education and Training Minister Sue Ellery said vapes and e-cigarettes are designed to appeal to young people, coming in colourful packages and flavours, and also being easy to conceal and reasonably cheap. About 24,000 WA secondary school students have tried a vape, with concerns that nicotine contained in vapes is highly addictive and that many parents are not aware that it's illegal without a prescription. The popular products are often toxic and can contain harmful substances found in cleaning products, weed killer, nail polish remover and bug spray.
Vince Catania, WA Nationals MP for North West Central, has made a shock announcement that he is retiring from the West Australian State Parliament after more than 17 years of service. Despite being re-elected not long ago in the 2021 state election, Mr. Catania said that he had decided to step down as he wants to spend more time with his family. He said he has spent most of his time driving around, living in his car, at times travelling more than 140,000 kilometres a year.
It's time to spend that time with the family rather than driving around. It's sad. It's sad to leave Parliament. It's, I'm sure, a shock to many of my constituents, but those who know me know how I've operated over the last 17 years, and that is making sure that I serve my community to my best of my ability.
I'd say two things. Don't slam the door on your way out. And the second thing I'd say is he has form of leaving parties when it's the worst time to leave those parties. It's the second time he's done this.
Will Labor be campaigning hard for you soon?
That's a matter that'll be determined by the party.
WA police are investigating the assault of the woman last year that could be determined to be a hate crime. The 35-year-old woman was crossing the road at the intersection of Redding Street and Childgrove Avenue in December when a passenger in a car shouted abuse at her. She walked to a park where she was attacked by a man and was later treated at Rockingham Hospital for a fractured cheekbone and nose, 6 chipped teeth, black eyes and a laceration. The victim believes she was targeted due to her transitioning gender identity, and WA police urge anyone who saw the man or vehicle or who has information about the attack to contact Crime Stoppers.
A group of talented children participated in a local robotics tournament after missing out on an international competition in the United States due to travel costs and visa issues. Children showed off their abilities to create and compete among their peers this week in an event held by Engineering for Kids, with aims for self-improvement under the encouragement of tutors and parents. Many machines you see here are created and designed by the kids themselves, with hopes they can participate in the world competition next year.
They were very disappointed that they couldn't go to the US, but they're very excited that they can do this internal competition that we following the VEX in robotics international standards, so they can see how much they improved since the last national competition.
I saw quite a few students that are able to shoot quite a few balls at the same time, so they engineer all these machines by themselves, is that
yes,
right?
Yes, they design, build and tested all of these by themselves, so they don't have any instructions, so we're very, very proud of them.
Well, it's really fun to enjoy just building a new robot. The concept and the idea was really fun. I enjoyed myself really well here. Well, they're doing better since now they can actually shoot the balls constantly, and we're doing really well right now, actually.
Although it's a little bit sad to see them not be able to go to the United States for the international competition, but having said that, you have to give them kudos for having so much talent at such a young age.
That's right, Ivan, and I wish them all the best for next year.
And now, here's AMA-WA spokesman Dr. Andrew Miller with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time on what is a pretty tough weekend for our hospitals again in the public sector with a lot of overloading for the capacity of the system that we currently have, and unfortunately the government's still not stepping up with the amount of resource that is going to be required to address this situation. And it's gotten worse because now what's happened is a lot of long-term staff are checking out because they don't feel that they can contribute. A lot of them burnt out, having been doing double shifts and so on for a long time to try and provide the care that they know patients deserve when they're reaching out for emergency help. So it's really going to take a strong intervention from the state government, a bigger contribution of funds from the federal government, who should be matching at 50-50 now. And everybody needs to accept that this is a problem a long time in the making, needs fairly revolutionary improvements. We have still 280 or so people in hospital with COVID in Western Australia. The number of deaths in this pandemic are increasing and have been doubled, in fact, in the last 3 months, from an average of about 20 a day to now over 40 a day, around 43 per day, unfortunately, across the country. So the idea that COVID is over is a marketing thing. It's not a real thing. And so we need to be concerned about variants that are got some resistance to vaccines, about reinfection over time, and about the long COVID burden also on our hospital system. So all of these are the prevailing winds against us, but we do have good resources. We do have some good solutions. We do have some antivirals, but they're not being widely used. We do have some vaccination, hopefully, for children under 5 very soon, although this hasn't yet been implemented. And with the news, a big study out of the US showing that babies in the womb are affected, unfortunately, by their mother's COVID infection, particularly if it's in the final trimester. We need to urgently understand that and also accept that if it can damage those babies, it can probably damage ones after they're born as well. So we do need to get that vaccine out there for under 5s and prevent transmission of the disease where we can, using simple measures that are no big burden to people. So we're not saying we need to lock things down, but what we do need to do is be using masks indoors in public, particularly in crowded situations. And we do need to be improving the ventilation of buildings, and we know there's a lot that we can do to improve fresh airflow through buildings. So stay safe out there. It's not over yet. You have to play the game until the final whistle blows. And if you don't, you're at risk of getting what we're seeing in other countries, which is simply a resurgence of different variants over time and getting into this cycle of the hospitals not coping, which unfortunately means that we have to replace healthcare workers, and we know that it takes a very long time to train those up, and they're a very precious resource, and we should be looking after them just like we do with our fresh water. So thanks for your time. Stay safe and look after the ones you love.
That's Dr. Andrew Miller, and here's Leo with what's coming up on 6 News tonight.
Thanks, guys. And on 6 News, legalised cannabis MP Brian Walker tells 6 News the WA Upper House has failed as a house of review, says the state has a semi-autocratic dictatorship with the Labor government's majority in both houses, and that now could expand with one of only a few Nationals MPs resigning. Plus, as federal Liberal MPs declared mask results in WA is catastrophic, an idea from Scott Morrison to establish the Liberal National Party brand Australia-wide is generating conversation with the new progressive Liberal movement of the coalition partner instead of the Nationals. And as temperatures plummet across the country with cities shivering through the first few weeks of winter, could it get even colder? You can see full details on those stories and plenty more by heading to our website, 6newsau.com. For now, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs. You have the latest news on our website, wamnnews.com.au.
Don't forget to subscribe to the WAMN Extra News Club so we can continue our work in the community. Full details on wamnnews.com.au/news/extra. From Melly and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.